The rate of diabetes in our country has approached 20%. In other words, 1 in 5 people over the age of 18 is now diabetic. And there are very serious speculations about the nutrition of diabetic patients. Everyone recommends something different for people with diabetes. So, what is the most accurate and scientific way for a diabetic to eat? In this video, you will find scientific facts. First of all, I would like to mention this. In our clinic, endocrinology, internal medicine, cardiology, and dietitians work together. So as a cardiologist, diabetes is especially within our field of interest because diabetes is a serious risk factor for cardiovascular disease. The risk of heart attack in diabetic patients has increased significantly. That's why we want to treat diabetes. When diabetes is properly treated and dietary recommendations are followed, the dosage of medications can gradually be reduced. Especially in type 2 diabetes with lifestyle changes, we can reach a point where insulin is no longer needed. That's why we place importance on dietary changes in diabetes. For this reason, the first thing we pay attention to in diabetes is the choice of carbohydrates. A diabetic patient should know what is a complex carbohydrate, what is a simple carbohydrate, and what is a source of sugar. For example, foods like white rice, from which the bran has been removed and which has been stripped of its brownness, and white bread generally have a high glycemic index and can put diabetics in a difficult situation. Similarly, sugary drinks, pastas, and desserts, whether they contain milk or not, are generally problematic for people with diabetes. For diabetic patients, we want them to turn to sources of simple carbohydrates such as grains, nuts, legumes, and beneficial seeds. In other words, a diabetic can and should consume carbohydrates. But what's important is to switch from simple carbohydrates to more complex carbohydrates. That is, brown rice is still rice and white rice is also rice. But while the glycemic load of brown rice is lower for diabetics, the load of white rice is higher. That's why we want to avoid carbohydrate sources that can cause insulin spikes, especially sweets, sugar-containing drinks, white breads, and pastas. These are problematic for us. Secondly, vegetable and fiber consumption. A diabetic patient should eat in accordance with the Mediterranean diet. In diabetes, our clinical approach is generally the DASH protocol. The DASH protocol is known as the diet that stops hypertension. A person who follows the DASH protocol can overcome not only hypertension but also diabetes. Clinical studies have found the DASH protocol to be very beneficial for diabetic patients. In our clinic, we generally implement a modified Mediterranean diet or the DASH protocol. The indispensable part of the DASH protocol is the consumption of vegetables and fiber. A diabetic patient should generally be consuming vegetables and fiber. Thirdly, beneficial sources of protein. If a diabetic patient consumes processed meat, their diabetes will get worse. Processed meat products are toxic for the pancreas and the stomach. Instead of processed meat products, they should opt for leaner and healthier sources of meat. Among these, fish is the most beneficial. In second place is white meat, and unfortunately, red meat comes in third. The reason red meat comes in third is that excessive consumption increases the risk of cardiovascular disease. In general, we want diabetic patients to consume fish. Also, diabetic patients absolutely must avoid processed meat products such as salami, sukak, and sausages. Especially meat products that have undergone heat processing are problematic for us. Fats come in fourth place. Diabetic patients should consume healthy fats. Olive oil in particular is the most ideal fat for diabetic patients. While butter does not harm diabetic patients, excessive consumption may increase the risk of cardiovascular disease. While avocado oil is a very healthy fat for diabetic patients, excessive consumption, just like with butter and coconut oil, can increase the risk of cardiovascular disease. So, when it comes to fat consumption, the amount is just as important as the variety. Excessive fat consumption, whether it's olive oil or butter, can increase the risk of cardiovascular disease. Again, a diabetic patient should never consume their food by frying it, because when a food is fried, it becomes toxic. The arrival of these toxic products in the pancreas puts diabetic patients in a difficult situation. In diabetic patients, we want the already damaged pancreas to function more effectively. However, excessive consumption of fried foods and trans fats can put a strain on your pancreas. And finally, fruit and milk consumption. Fruit is beneficial and milk is not harmful, but excessive consumption of milk and fruit can put diabetic patients in a difficult situation. In our protocol, the diets of diabetic patients generally include fruits with a low glycemic index. In particular, berries are added to the diets of diabetic patients. Berries are protective against diabetes thanks to the anthocyanins they contain. For example, among berries, strawberries are very beneficial. Pomegranate is beneficial for diabetics, but excessive consumption, whether it's too much milk or too much fruit, creates a sugar load for the body. In general, milk consumption is not problematic for diabetics. In fact, consuming natural milk and natural yogurt supports pancreatic health because they contain beneficial bacteria. In other words, they are probiotics. However, excessive consumption of milk puts strain on the pancreas. Because too much milk is essentially sugar, apart from what I've mentioned, every supplement and every diet detail given for diabetes is just a detail. A diabetic can manage their diabetes very well simply by paying attention to what I've mentioned. By watching their calorie intake, especially in type 2 diabetes, they can gradually lose even a small amount of weight and thus seriously overcome diabetes. In our clinic, we take very effective actions for diabetes every week. We discontinue the medication of many diabetic patients. With many patients who use insulin, we reach the point where we can discontinue insulin. And we do this entirely with specialists in the field. We achieve this by changing the lifestyle. You too can manage your diabetes very well with lifestyle changes. But be careful, do not stop taking your medications. Never try to stop your medications without consulting your doctor. Do not harbor hostility towards your medications. As long as you are willing to change, we will discontinue the medications one by one.